Okay, picture this. You wake up and one of your joints is just screaming in pain. Not your usual ache, but something really intense, swollen, maybe even hot. What if that's not just arthritis acting up? Today we're doing a deep dive into something called septic arthritis, or infectious arthritis. It's a serious condition, a real medical emergency that can actually destroy a joint in just like 24 to 48 hours if you don't get treatment. It affects quite a few people, thousands every year, and seniors seem to be particularly at risk. Often gets mistaken for less dangerous things until it's almost too late. So our mission today is pretty straightforward. We want to arm you with the key things you need to know about this: what it is, why some folks are more vulnerable, what causes it, and, crucially, the warning signs and how you might prevent it. It's really about understanding this threat so you can be proactive about your health, right?
Exactly. That scenario you just described, that sudden, really bad pain, that's precisely the kind of thing we need people to recognize immediately.
Yeah.
Because septic arthritis, it's not just inflammation like in regular arthritis, it's a full-blown infection. Harmful bacteria have actually gotten inside that delicate joint space.
Inside the joint itself? Wow.
Yeah. Think of your joint, it's got this natural lubricating fluid, synovial fluid that keeps things moving smoothly. But when these bacteria invade, that fluid becomes, well, a perfect place for them to multiply. And they multiply fast, causing massive inflammation. And they literally start to eat away at the cartilage, the cushioning, and even the bone underneath.
Eating away at it. So it's not just causing pain, it's causing active physical damage, like really quickly. That's unsettling.
It is, absolutely. And the scary part is your joints don't have much of a built-in defense system against this kind of attack.
Yeah.
Unlike, say, your skin, which has ways to fight off bugs, once bacteria get into that joint space, it's almost like a perfect storm for destruction.
Yeah.
The infection takes hold very quickly and can cause severe, often permanent damage.
Okay, that makes the urgency crystal clear. Now, you mentioned seniors are particularly vulnerable. Why is that? What makes people over 60 more susceptible to this kind of rapid joint destruction?
Yeah, that's a really important point. It's often a combination of factors that sort of stack up against us as we get older. First, there's something called immunosenescence. Basically, our immune system just naturally gets a bit weaker with age. So it's less effective at fighting off infections anywhere in the body, maybe before they even get a chance to travel to a joint.
Okay, weaker defenses overall.
Right. Second, our skin tends to get thinner and more fragile. This means even small cuts or scrapes can become easier entry points for bacteria. And third, many older adults are already dealing with existing joint problems like osteoarthritis or rheumatoid arthritis. Those conditions mean the joint is already compromised, maybe with some damage or inflammation, making it sort of easier for an infection to take root.
So pre-existing conditions open the door a bit wider.
Exactly. And it gets particularly concerning for people over 80. They face the highest risk. The mortality rates in that age group can range anywhere from 22% up to nearly 70%.
Wow, 22 to 69% mortality. That's incredibly high. Why is such a wide range there?
That's a great question. It often reflects, the person's overall health before the infection hits, and crucially, how quickly they get diagnosed and treated. Someone with multiple other health problems, maybe uncontrolled diabetes or someone on strong immune-suppressing drugs, they're likely going to be at the higher end of that risk, especially if there's a delay in getting help. And a big part of the danger, particularly for seniors, is that delay. They might feel that sudden pain and think, oh, it's just my arthritis acting up again, and they wait. But with septic arthritis, waiting loses incredibly precious time.
That makes sense. Delay is the enemy here. You mentioned bacteria. Are there specific types we should know about, the main culprits?
Yes, absolutely. The most common one responsible for the majority of cases is Staphylococcus aureus. You might know it as Staph. Staph bacteria often live harmlessly on our skin, actually, but if they get into the bloodstream or directly into a joint, they can be really destructive.
Okay, Staph is number one.
Then you have Streptococcus bacteria. They're the second most common. And particularly in older adults, we also see infections caused by what are called gram-negative bacteria, things like E. coli. These can account for almost 30% of cases in older folks. And sometimes they're a bit tougher to treat, maybe more resistant to common antibiotics.
Okay, so we know the bad guys, but how do they actually get into the joint? They don't just teleport there, right?
Right. No teleporting involved. There are three main routes or pathways. The most common way is through the bloodstream. Bacteria from an infection somewhere else in your body, maybe a urinary tract infection or a skin infection like cellulitis. Even sometimes dental problems like an abscess can get into your blood and travel to a joint.
So an infection elsewhere can seed the joint.
Precisely. The second way is through direct injury. A fall where you cut yourself near a joint, a deep puncture wound, maybe even an animal bite, that can introduce bacteria directly into the joint space from the outside. And the third pathway, less common but still important, is through medical procedures. Things like joint injections, maybe for cortisone, or even joint surgery itself. While procedures are generally very safe and sterile, there's always a small risk of introducing infection.
Got it. Bloodstream, direct injury, or medical procedures. Are certain joints more likely to be affected than others?
Yes, definitely. Knees are the most common target in adults. They're large, weight-bearing, and maybe a bit more exposed to injury. Hips are a close second. Hip infections can be particularly tricky because the joint is deeper, so the signs might be less obvious initially, potentially leading to delays in diagnosis. Shoulders, ankles, wrists, even smaller joints can get infected too, but those big weight-bearing ones, especially the knee and hip, face the biggest threat.
And for seniors, you mentioned earlier, it's often not just one risk factor, is it? It's like a combination.
That's exactly right. That cumulative risk is really key. An older person might have, say, diabetes, which we know affects the immune system and circulation. They might also be taking medication for rheumatoid arthritis that suppresses their immune system further. And maybe they've had a knee replacement surgery in the past. Each of those things adds a layer of risk. So you can see how multiple factors happening at once really increases the vulnerability. That's why awareness and vigilance are so crucial for this age group.
This is painting a pretty serious picture. So what happens if it isn't caught quickly? What's the sort of domino effect of delaying treatment?
The consequences are, frankly, devastating and happen fast. Within just a few days, that infection can literally chew through the smooth cartilage lining the joint. Cartilage doesn't really grow back well, so that damage is often permanent. Then the infection attacks the underlying bone, causing erosion. The joint fills up with pus and inflammatory gunk. Eventually, the joint can become totally destroyed, completely non-functional.
Non-functional meaning?
Meaning it might lock up, be constantly painful, unable to bear weight. In really severe cases, the damage might be so bad that the only options are surgery to fuse the joint solid, which eliminates movement, or, in the worst-case scenario, amputation of the limb.
Amputation? That's terrifying.
It is. And the danger doesn't necessarily stop at the joint. The infection can spill out into the bloodstream. That's called sepsis. Sepsis is a life-threatening emergency where your whole body is overwhelmed by the infection. It can lead to organ failure, shock, and sadly, it can be fatal. Studies show that even among survivors, somewhere between a quarter and a third of patients end up with permanent functional problems in that joint.
Okay, the stakes are incredibly high. This makes recognizing the warning signs absolutely critical. You said septic arthritis announces itself with urgency, unlike regular arthritis. Let's talk about those signs.
Yes, let's. There's what doctors often call the classic triad of danger signals. These are red flags that should make you think emergency right away. First, intense joint pain that comes on suddenly, and I mean sudden. Maybe you went to bed feeling okay and woke up in agony. The pain is often described as far worse than any usual arthritis pain, maybe burning, throbbing, like the joint is on fire. It's not an ache you can ignore.
Okay, sudden, intense, maybe burning pain. Got it. What's second?
Second is significant swelling that appears rapidly, often overnight or within hours. The joint looks visibly larger, puffier than usual. It might feel really tight, like the skin is stretched, and often the skin over the joint will be red and noticeably hot to the touch. Sometimes family members can actually feel the heat coming off it compared to the other side.
Wow. So pain, swelling, heat, redness, all happening fast. What's the third part of the triad?
The third is a severe limitation of movement. Trying to bend or straighten the joint, even just a little bit, causes excruciating pain. Often people find they absolutely cannot put weight on the affected leg, or they can't lift the affected arm at all. It's not just stiffness like you might get with osteoarthritis, it's the joint basically refusing to move because of the intense pain and swelling.
Okay, that triad, sudden, severe pain, rapid swelling with heat redness, and inability to move the joint sounds like a clear alarm bell. Are there other signs the body might send, maybe more general ones?
Yes, there can be systemic signs too. A fever is pretty common, present in maybe about half the cases. And this is really important, you can have septic arthritis without a fever, especially if you're older, maybe over 80, or if your immune system is suppressed by medications or illness. So lack of fever doesn't rule it out. When a fever is present, it often comes with chills, maybe shaking, sweating, and just feeling generally really unwell, like you've got a bad flu, but localized to that joint pain.
Feeling really sick, not just sore.
Exactly. And then there are what we call constitutional symptoms. Things like extreme fatigue, more than just tired, like wiped out. loss of appetite, sometimes even confusion, especially in older adults. There's often this general sense that something is seriously wrong here. Trust that feeling. Your body often knows when it's facing a major threat.
It sounds quite different from other joint problems then.
It usually is, yes. Osteoarthritis, for example, typically comes on gradually, affects multiple joints, and that morning stiffness tends to get better with movement. Septic arthritis usually hits one joint hard and fast, and the pain just gets worse, not better. Rheumatoid arthritis flares often involve multiple joints too, and while there's pain and fatigue, the intensity and suddenness of septic arthritis pain in a single joint is often distinct. Even gout, which can also cause sudden severe pain and swelling, often in the big toe or ankle, tends to peak in intensity within about 12 to 24 hours and then start to improve on its own. Septic arthritis pain typically just keeps escalating without treatment.
Are there any special things seniors or people with certain conditions need to keep in mind?
Definitely. For someone with rheumatoid arthritis, telling the difference between an RA flare and septic arthritis can be tough because symptoms overlap. A key clue, though, is that septic arthritis usually hits just one joint during that episode, whereas an RA flare typically involves several joints at once. People with joint replacements need to be vigilant too. An infection in an artificial joint might not always present with that dramatic triad. It can be more subtle, maybe just increasing pain with activity or even at rest, a feeling that the joint is loose, or a gradual decrease in their range of motion. And this can happen even years after the surgery. And for people with diabetes, as we mentioned, their immune response can be blunted, so they might not mount a high fever, or the redness and swelling might be less pronounced. They and their doctors need to have a higher index of suspicion.
This really highlights the need for quick action. So when is it time to say, okay, this is not something I wait on? When do you absolutely need emergency care?
Honestly, any combination of that sudden severe joint pain, especially with rapid swelling and any fever, warrants an immediate trip to the emergency room. Don't wait to call your doctor's office in the morning. Go to the ER. And even if you don't have a fever, if you suddenly develop excruciating joint pain that stops you from moving, normally you can't walk, you can't lift your arm, and that also needs urgent evaluation right away. If you have any of those risk factors we talked about, older age, diabetes, RA, a joint replacement, you should have an even lower threshold for seeking immediate care. It is always, always better to be safe than sorry with this condition.
And what happens when you get there? How do they confirm if it is septic arthritis?
They'll usually do blood tests to look for signs of infection and inflammation. But the gold standard, the definitive test, is called arthrocentesis. That means they numb the skin over the joint and use a needle to draw out some of that synovial fluid from inside the joint space. Analyzing that fluid is crucial. They look at it under a microscope for bacteria and white blood cells, and they send it to the lab to grow cultures. That helps identify the specific bacteria causing the infection, which is vital for choosing the right antibiotics.
Okay, so diagnosis involves actually sampling the fluid. Makes sense. Now let's shift gears a bit towards prevention. Understanding your risk is key, you said, like having a roadmap.
Exactly. Knowledge is power here. Some risk factors, well, we can't change them. Age is the big one. Being over 60, and especially over 80, puts you at higher risk simply due to those natural changes in the immune system, the immunosenescence we mentioned. Having existing joint damage from osteoarthritis or an autoimmune condition like rheumatoid arthritis or even a previous joint injury, those also increase risk because the joint structure is already compromised.
Right, those are things we have to work with. But you also mentioned modifiable risks, the areas where we can actually make a difference. Let's get into those.
Absolutely. This is where proactive steps really count. Diabetes management is huge. If you have diabetes, keeping your blood sugar levels under tight control is critical. High blood sugar weakens the immune response and basically creates a welcoming environment for bacteria. So good control really helps protect your joints.
Okay, diabetes control is number one. What else?
Medication awareness. If you're taking drugs that suppress your immune system like steroids or biologics for RA or other conditions, you need to be extra vigilant. Work closely with your doctor, usually your rheumatologist, to make sure you're on the lowest dose that still controls your condition effectively, and be aware of the increased infection risk.
Makes sense. Be smart about immunosuppressants.
And then there's skin integrity. As we age, skin gets more fragile, right? So even minor cuts, scrapes, blisters, or skin conditions need proper care. Clean any break in the skin promptly, use an antibiotic ointment, keep it covered with a bandage until it heals. Pay attention to areas where skin might break down, like pressure points or skin folds. Moisturizing helps keep skin healthier too. Basically, treat your skin like the important barrier it is.
Good skincare is a defense strategy. I like that. Beyond managing specific risks, are there more general, maybe natural ways to kind of boost our body's resilience?
Definitely. Supporting your immune system overall is a great foundation. Eating healthy diet rich in nutrients is key. Think vitamin C from citrus fruits and bell peppers, zinc from things like pumpkin seeds or chickpeas, vitamin D from sunlight or supplements if needed. These all play roles in immune function. Some people also find traditional herbs like echinacea or elderberry helpful for immune support, though you should always discuss supplements with your doctor.
So nutrition is a cornerstone. What about keeping the joints themselves healthy?
Yes, maintaining joint health is important too. Regular, gentle exercise is fantastic. It keeps the joints mobile, improves circulation, which helps deliver immune cells if needed, and strengthens supporting muscles. Things like swimming, tai chi, gentle yoga, walking, tocation, they move the joints without pounding them. And certain foods might help reduce inflammation overall, which could be beneficial. Things like turmeric, which contains curcumin, fatty fish with their omega-3 fatty acids, tart cherry juice incorporating these can be part of a joint-friendly diet.
Okay, good diet, gentle movement. What about preventing those initial infections that could travel to the joints?
Ah, yes, that's crucial. Vigilant infection prevention elsewhere in the body is key. Good dental hygiene is surprisingly important. Bacteria from gum disease or dental abscesses can easily enter the bloodstream. So, regular checkups, cleanings, flossing, and getting any dental problems treated promptly is vital. Wound care, as we mentioned, is critical. Clean any cut, scrape, or bite immediately and thoroughly. Watch for signs of infection, increasing redness, warmth, pus, red streaks moving away from the wound, and see a doctor if it's not healing properly. And urinary tract health. UTIs are common, especially in women and older adults, and they can lead to bacteria in the bloodstream. Staying well hydrated, practicing good hygiene, and getting UTIs treated quickly helps prevent that.
Dental, wounds, UTIs, covering the bases. What about those high-risk folks, like with joint replacements? Any special advice?
Yes. For people with joint replacements, the guidelines have actually changed a bit over the years. It used to be common practice to take antibiotics before almost any dental procedure. Now, for routine dental work like cleanings or fillings, prophylactic antibiotics generally aren't recommended anymore for most people. However, it's still super important to discuss any procedure that could potentially introduce bacteria into the bloodstream, whether it's dental, urological, gastrointestinal, with your orthopedic surgeon beforehand. They can advise if antibiotics are needed in your specific case. And again, people with replacements need to be alert for those subtle signs of infection we talked about: new or worsening pain, feeling of looseness, reduced movement, even if it's years after the surgery. Don't ignore those symptoms.
Good point about the changing guidelines. Any final thoughts on prevention, maybe environmental things?
Just a couple of quick ones. Be mindful in places like hot tubs or public pools. Make sure they seem well maintained, and maybe shower off afterwards. And while we love our pets, be careful with scratches or bites. Cat scratches in particular can sometimes cause nasty infections. Clean them really well and watch them closely.
Okay, so it really sounds like an integrated approach is best managing health conditions, protecting your skin, good hygiene, maybe some immune support.
Exactly. It's not about doing just one thing, it's about building multiple layers of defense. Managing your diabetes, taking care of your skin, staying on top of dental health, being cautious with wounds, supporting your immune system through good nutrition and lifestyle choices, and having regular checkups. It's not about living in constant fear, but about living wisely, being proactive. And the bonus is, most of these preventive steps are good for your overall health anyway.
That's a great way to put it, living wisely. So let's bring this all together. What's the main takeaway for everyone listening? You now have this knowledge, right? You can recognize how septic arthritis might try to fool you, looking like regular joint pain. You know the critical warning signs to watch for, and importantly, you know there are many things you can actually do to protect yourself. Remember, septic arthritis is not just a normal part of getting older. It's often preventable, and it's absolutely treatable if you catch it early. This knowledge really is a powerful tool.
Absolutely. So, based on everything we've discussed, here's a simple 3-step action plan for you. First, assess your own risk factors honestly. Do you have diabetes? Is it well controlled? Are you on immune-suppressing drugs? Do you have a joint replacement? Have a conversation with your doctor about your specific risks and what vigilance looks like for you.
Okay, know your personal risk level. Step 1.
Second, implement those preventive strategies we talked about. Pick a few that make sense for you. Maybe focus on improving your diet for immune support, or being more diligent about skincare and wound management, or finally scheduling that overdue dental checkup. Small steps add up.
Step 2. Take proactive preventive action. Got it.
And third, and perhaps most importantly, trust your instincts. If you experience that sudden severe joint pain, especially if it's different from anything you felt before, or if it comes with swelling, redness, heat, or fever, don't second guess yourself. Seek immediate medical attention. Go to the ER. Remember, it's far better to be overly cautious and find out it's something minor than to dismiss something serious and risk devastating consequences.
Assess risk, prevent proactively, and trust your gut. Seek help immediately if worried. That's clear and actionable.
Yeah.
Your joints have carried you through decades of life, through all sorts of adventures. Now, armed with this understanding, you have the power, the wisdom to really protect them in return. This isn't just about dodging a dangerous infection. It's about embracing a proactive stance towards your health, maintaining your mobility, your independence, and your confidence as you age. And maybe share this information. Talk about it with family, with friends, especially older loved ones. Creating that network of awareness can make a real difference, because ultimately, knowing what to look for is the best defense we have.